Thanks for joining us on this edition of Vaxxed versus Variants. We're going to talk about a lot of things, including the latest information. We're giving you an update and a discussion from a community standpoint and those who've been on the front lines, as well as those who have been fighting this thing in the medical community. All on this edition of Vaxxed versus Variants. But first, here's the latest information and data from the Cuyahoga County Board of Health.
Currently, we have moved through the fifth wave of the pandemic so far. And so with each wave, we've had varying levels of cases that have been reported over that time. Currently, we have over 187,000 cases that have been reported for the Cuyahoga County jurisdiction. Over 7,500 hospitalizations have been reported today, and over 3,700 deaths have been reported in the county overall to date. So when we initially started out at baseline, we were at about 50 cases per day. And as we started to see surges, we moved into the hundreds. From there, we moved to over 500 a day. And from there, we moved over to 1,000 a day. And then in our most recent wave with Omicron, in December and January, we moved to over 3,000 a day. So that gives you a sense of the different waves and phases that we've moved through since the pandemic started. Currently, we're back at baseline where we started back in March of 2020. So we're currently at about 50 cases per day is what we're seeing now as the Omicron surge has subsided. So what we're finding now with vaccination is that there is a range. So we're anywhere from certain zip codes, we're anywhere from 30% coverage in vaccination all the way up to more than 90% coverage in vaccination. And we have found that some of the communities that have the lower vaccination rates are communities that predominantly are made up of people of color. And so it is very important that we continue to push for vaccination within those communities, given the vulnerability of the populations that live there. And so that's something that we continue to work on and something that we think is very important. What we do know is that vaccination decreases your chances of contracting COVID and having severe outcomes in relation to COVID, so in relation to hospitalizations as well as deaths. So with that, we know among those that are unvaccinated, you're 12 times more likely to be hospitalized if you are unvaccinated and you contract COVID-19. We also know that if you're unvaccinated, you're 7 times more likely to have a fatality or a death result as a result of contracting COVID-19. And so we know with those stats, the higher level of those people who are unvaccinated being susceptible to severe outcomes is there. And so that's why we really want to promote and really push for people to get vaccinated, because it's the best protection. Having the pandemic end is not a strategy. So we have to move to continue to work on what we need to do to protect ourselves in order for this pandemic to end.
Thanks for joining us on this edition of Vaxxed versus Variants. Joining us are Danielle Signor, president of the NAACP Cleveland, Yolanda Armstrong, the president of Friendly End Settlement, Dr. Latasha Jarrett from the Centers. She is the chief medical officer, and Marsha Maccabee, the president and CEO of the Urban League of Greater Cleveland. First, I want to start off with you, Dr. Jarrett. When I said we are on the front lines, anyone that's in the medical or science profession have been watching this very, very closely. Can you give us the latest update or what you know as it relates to where we are with this virus?
So there are the regulations and mandates are, when we think about our country, are being removed in lots of areas. We see that the public has become more comfortable. We see people not wearing masks, less social distancing. However, as we look throughout the world, we hear in places like Asia where there are new variants of even Omicron and the numbers are increasing. So there is this definite kind of fatigue that we have with the last 2 years of we just want to move on. I know everyone wants to move on. However, the virus may not necessarily be ready to move on. And so therefore we just have this pull and tug of, as we see what happens in the world and we recognize over the last 2 years that what is here in this part eventually will be in another part. And then being able to be mentally prepared as it pertains to going back to the precautions if it does arrive, and being willing to accept that maybe the way we approach life may be a little bit different, and for the present as well as for the future.
Well, all of us have had our own versions of how it's affected us. Talk to us a little bit about being the leader that you are in the community, in the inner city, what you had to do, the safety measures, and all the other things as you helped and took care of people in the senior citizens realm, as well as children, after school programs. How did it affect your organization?
Wow. So much happened during that time. One thing we had to do was work together as a team. Half of my staff were allowed to work from home. They were community health workers that usually have face-to-face visit with families, so they were able to do telehealth. And then the other part of my staff, we were the ones who had to be there every day, working to help families who were in need of food. We had an after-school program at one point in time, but then worked together collectively with the Cleveland Metropolitan School District to basically establish learning pods. So we needed to stay open for families. Had to educate a lot of families in the community because we know majority of the families that live in the community in which we serve, which is in the central area, are people of color. And many of them had already been diagnosed with COVID-19. Many folks didn't want to get the vaccination when that came out. And just trying to be that organization that tries to meet the needs of the people in the community. So we had people who lost their jobs. I can tell you right now, our child care center was affected tremendously because we received vouchers. Because people lost their jobs, they lost their vouchers. We had 98 kids pre-COVID and then ended up with about 10 kids left in our program, which affected our program a great deal. But we were able to partner and collaborate with another organization and start an early Head Start program. They assumed the staff that I had, and then they began leasing out my facility so that they can still provide that service. The win-win for us in Central was the fact that now those parents who had lost their vouchers because they lost their jobs, now that they can bring their kids to the early Head Start program and now go look for a job. One thing about Friendly Inn, we try to do the best we can to serve the people in the community. So we served over 65,000 meals last year, the first year of COVID. And then the second year, we're probably close to that number again. We're in the midst now of looking at our numbers, trying to see the number of people that we served at that time. But I would say out of that, a lot of us recognize the fact that this work can't be done if we didn't work together to get it done. We believe in our mission and vision of our organization, and we want to do the best we could to serve the people in the community. But then it affected us personally because I've had a couple of staff who have lost people to COVID. I myself have lost people to COVID, and it's a trying thing. But I also know that God sustains us. And because of that fact, I think within our organization, we continue to move forward. And as a leader, I had to be that person that when staff came to me about different situations, being open-minded, being empathetic, and then trying to work through those issues, because not just the people in the community were having issues, but then you had staff going through the struggle and then trying to be able to comfort and support them. So I have to say that with the help of our board, with the help of the staff, and then the people who were open-minded and collaborating, this is how we're still standing right now and being able to serve the community.
And just so proud to be a colleague with my sister Armstrong there, who did such amazing work and does such amazing work at Friendly Inn. So at the Urban League, as you know, we had a little bit different approach that we had to take. Because our services are a little different, we focus in the areas of business development, workforce development, and those kinds of things. So we were able to pivot to a purely technology platform to serve our clients. And in fact, we tripled the number of individuals we were able to serve at the Urban League because of serving on a virtual platform. And in particular, you think about business owners who are very busy working in their business every day. They don't often want to take time out to go someplace and take a class or so forth. So by providing these services virtually, they were able to, take less time away, less travel time and so forth, and get involved. The other thing that we're so very proud of at the Urban League was we actually developed a number of other technology approaches in the workforce area, and our SOAR 2.0 that allows individuals to access training, to access information, and to look for jobs right on their mobile device is just an amazing accomplishment that we're very proud of, and absolutely was driven by the need that we saw in the community and our response to it. So we've learned a lot. We would not have known that we had this strength and had these assets had the pandemic not happened. But as we know, we have an amazing, resilient, and resourceful and innovative staff who stepped up to the plate and did just what was needed to serve our community well, and I'm very proud of that. On a personal level, I infected myself after being fully vaccinated and boosted, contracted the Omicron variant. At Christmas time, it was a real different Christmas this year because I was in the bed Christmas through New Year's. But it was a very mild case. I was at home in the bed, not in the hospital, thank God, not on a ventilator. And not all the things that, my precious late husband had to go through because when he contracted COVID, there was not yet any vaccination. So, that of course was a very tough loss, for our family. And this time again, my oldest daughter and grandchildren live with me now, and we all had it. Well, all except for my grandson. Could not figure out how this male child did. But the women, all three of us had it, and we just sort of took care of each other. He did a great job taking care of us too. Bonded us even closer as a family, and everybody was fine. Nobody had to go to the hospital. We got through it, and just grateful, just really grateful. So we try to take everything that happens to us as a lesson learned and try to put it into practice to how it can help our community and how it can help us to go forward in a way that can make a difference.
Danielle, talk to us a little bit about how COVID affected you and how it led you to make the decisions as the leader of the NAACP here in Cleveland.
So it was a very, I would say, interesting time is probably the best way that I can describe it. I have 2 teenagers, so immediately school stopped being what it normally was for them. We were all in the house together. I was working from home. In addition to my full-time job, the places that I serve in community, I felt like every single organization I was connected with was literally on fire, working with seniors in long-term care facilities, working with the NAACP because we also had the social uprising that was happening at the same time, and then in my full-time role working with small business owners. I mean, it was like I went into crisis mode and really never got out of it.
I noticed that even on your social media platforms, trying to combat all the stuff, the misinformation, some of those conspiracy theories, what was it that you feel affected the outcome of so many of us not getting the vaccine?
I think the thing that drove most people that I communicated with not to get the vaccine was their concern about how rapidly it was put together. Because for many people, they got to the place where they recognized, like, okay, the vaccine is actually helping people and it's helping to reduce the number of cases. But there was just this underlying, mistrust or concern about how is it possible that we could put together something so quickly. And so I would do my best attempts to share my personal reasons why I got vaccinated, share why I chose to get my children vaccinated. And then really try and walk people through ways that they could communicate with their doctors or other healthcare professionals to better understand how long scientists had actually been researching the technology that was used in the vaccine. So while it felt very quick, the world was also shut down. And so you had more people at one time working on one issue, and that's not something we usually do.
We are all recipients of getting the virus and being boosted and vaxxed. So there are a lot of people out there, doctor, who are saying, well, they got it, but doctor, we're not on a ventilator, or we didn't have to be on one. Mm-hmm. So what do you say to those who aren't vaccinated and they're talking about, well, they all got vaccinated, but?
That's, whenever you think about vaccines, the first thing is, what does a vaccine do? It doesn't mean that you're not going to get whatever we're vaccinating you for. The whole idea is that if you do get exposed, if you do contract whatever we're vaccinating you against, and in this case, COVID-19, that you would have mild symptoms and not end up on a ventilator. So when individuals say, well, I beat it, well, you don't know if you beat it because you don't know what the long-term sequelae may be, which means the long-term side effects, because enough time has not passed. It's only been a short period of time, and it may be 5 years from now, 10 years from now. It could even be with a very small child who was exposed in adulthood, that there may be medical conditions that we're not aware of that will pose themselves. And we even know now, as they look nationally, and you look at various organizations that talk about individuals who had COVID very early on still have lingering effects a year later or 2 years later. So how do we know what the future is going to hold? So the best thing to do is to get vaccinated. That way, hopefully, if you do have symptoms, that your symptoms will be mild where you're at home and you're not in the hospital, you're not on a ventilator, or you're not debilitated in such a way that your life is not the way that it once was. And then most importantly, we don't want to be cavalier and say, okay, well, it didn't kill me, I didn't end up. But again, you do not know what the future may hold. Mm-hmm. And so that being said, the best thing is to try to do prevention. And that means thinking about, still in certain instances, you absolutely need to social distance as much as you can. If you're a worker where you do have to be in close proximity, then follow what the guidelines of your organization. They put rules in place, abide by them. If you're an individual that that you've gotten one vaccine, complete the series. If you've completed the series, go ahead and do the booster. But you don't want to get in the mindset of, okay, it's over, it's done, because we do not know. And as we've seen over the last 2 years, there have been times when we think that all is well, and then all of a sudden, here we are with numbers spiking up, everyone is panicking. And so we just have to keep in the mindset that we're in a territory of unknown. And so we have to be prepared, and we can't be lulled.
When you're thinking about Central and other communities, Fairfax or Glenville or Union Miles, there's a large concentration of African Americans as well as children. Does it concern you that our numbers are still low in pockets of our inner city where we have not been vaccinated? And what does that mean when a group of that magnitude aren't?
So it does concern me because, again, as we know, when you're looking at certain groups, even access to care, right? So you get sick, hospitals around you, facilities to take care of you, even the infrastructure with family members, are they in a position now if they have to care for you? So if they can't work, how does that impact? Everyone doesn't have an infrastructure in place where if mom is sick, I can take off from my job and I can come and see her. Or if you have to be hospitalized, how am I going to get back and forth to the hospital if I can go? And if I'm sick and I have limitations with childcare, what does that mean? So all of those things have to be taken into account. And then when you look at, even when you just think about people in general, a lot of times as African Americans, we may have different experiences, irrespective of socioeconomic, when we step into certain arenas. We have different experiences. And so you don't want to be in a situation where you know that it is a virus, this unknown. We know that the unvaccinated has a totally, in most cases, a much worse course than someone who is. And so then we know that we are still hoping in this country to have the same equality when different individuals step into the hospital, the quality of care, the seriousness that's taken about our medical conditions. We're still growing there. And you know, people are human, and you don't want to face that where people are kind of like, well, why didn't you get vaccinated? You know, and so it does worry me. It worries me because we've put a lot of effort, and we want people to reach out. If you're not sure, talk to us. There's health centers like my own. There's other facilities that are willing to provide education to anyone who wants to know about vaccines, to be able to give vaccines. There's been multiple events even in the city where people have received payment of sorts, or, you know, gifts and other things, not to pay you to get a vaccine, but just to help you along the way. And so we just don't want people to not get vaccinated because they feel like that no one is going to answer their questions or walk them through the benefits versus the risk. There are a lot of people here, and you should only do what you feel like you're informed, but we're willing to inform you. So one of the things we're very excited to offer at the centers is rapid PCR testing. I know that traditionally when people think about, they get swabbed, it goes off to a laboratory. And so there has been monies contributed by the state and federally to be able to offer it literally within 30 minutes. So we can do a similar, which is a PCR test. When you think about the at-home tests, those are not PCR, but we have that technology available. So we definitely encourage individuals, if you think you have COVID, if you think you may have been exposed to COVID, please get tested. And with the options that we have for testing, you know, you have your at-home test kits. We have rapid test kits, the one we discussed, and also we have the send-outs. And sometimes you can do a combination of both. For instance, if you come to one of our health centers and you pick up a home test kit because you want to test later, go ahead and let us do one and send one out, just in case, because even with those test kits, there are times where they can be false negative, which means that the result appears negative when it is not. But the most important thing is that if you think you have symptoms of COVID, please get tested. And just by being vaccinated or by being boosted does not mean that you do not have COVID or that you've not been exposed to COVID.
With that said, we are writing the script as we go. There's a lot of things that we don't know, a lot of things that we have found out. From your perspective, from a leadership perspective, and the whole idea behind what do we want it to be said about how we were proactive against this pandemic. And the Urban League, along with the lead from the National Urban League, has been on the front lines. Talk to us about that.
So first of all, I'm so proud of how the National Urban League has really led in this time. We're so fortunate to be a part of such a strong national organization. And in fact, the National CDC has funded the National Urban League to then provide funding through its affiliates, and we're one of those recipients to do a lot of this great work that we do. So some of the cards that we have, the town hall, you know, all of the things that we're doing are as a result of the wonderful sub-grants that we've gotten through the National CDC, through the National Urban League. But you know, as a leader, we know that whenever there is a crisis, we are called often to be both an economic first responder and a health first responder, a social justice first responder. So in that first responder position, We have to do whatever it takes to get the word out, to get the message out, to use our influence, to reach in every portal that we can, to try to bring information, and just to make sure that we're connected. Sister Yolanda talked about the fact that working together. None of us can do this work alone. It takes the true village to really attack an issue like this. And I think when the end of the story is written, as you would often say, Sister Betty, we want to see that our name is in the chapter as one who helped to provide to this community for such a time as this.
Amen. That was wonderful. Coming up on Vaxxed versus Variants, an Urban League update, pediatrician Dr. Lolita McDavid of Rainbow Babies and Children's Hospital will discuss children and vaccinations next.
And we've had children in our intensive care unit, and they tend to be, unfortunately, people who are already at risk. They're overweight. They may have lung problems. They may have diabetes. I mean, those are the people who have the worst courses in this.
Hi, I'm Christian Sanders, and I've been a strong advocate of the COVID-19 vaccinations as I got the vaccination for myself. And with my health conditions, I saw that as, just a safe thing to do, especially with the work environment of which I was in at the time. However, for my children, I am not for or against the vaccine for them. Their vaccination statuses, especially with something that is optional, for me is like their diet, and I like to have educated conversations with them about the choices that they choose to make, and then allow for them to make guided and educated decisions based upon the education that their mother and I provide them with. And so at this point in time, I'm not going to say I would or would not vaccinate my children, but more or less educate them about the risk of non-vaccination, as well as, some of the outcomes of the vaccination, and help them make that educated decision on their own.
Well, COVID is here to stay. So if people think it's going away, it's not going away. As you can see, there are new variants, and it's going to change. That's what viruses do. They mutate, they change. So it's not going away. Vaccines have changed medicine incredibly. You can't believe it. I mean, I tell people in the last 125 years, the two most important things for child health has been clean water and vaccines. And at the turn of the 20th century, 107 out of every 1,000 babies would die before their first birthday from vaccine preventable diseases, from water contamination, and all just because we couldn't care for them either. Now it's 5 to 7 per 1,000 because babies who die now before a year of age are usually born too soon, too small, or have congenital defects that will not allow them to live. So people aren't afraid of the things that they used to be afraid of. And unfortunately, a lot of parents were vaccinated. I don't mean unfortunately, but they don't understand the importance of vaccine because they haven't had measles or chicken pox or mumps or recurrent otitis media infections that cause them to lose their hearing, the things that we used to see in child health. And so it's not scary, but it is scary to us in medicine. What we know is that vaccinations make a difference, that they do save lives, that they do minimize disease. And the science is why it's called science. It is based on actual fact and what people have learned over the years. When I got my COVID vaccine, the first one, I didn't have any symptoms. The second one, oh, wow. I mean, I was fatigued and it was because the vaccine was working. When you get the second one, your body goes, whoo, I don't like that. And it attacks the COVID that you got as the vaccine. That means it's working. With the booster, there was nothing. So herd immunity, it's H-E-R-D, and it means like a herd of cattle, okay? And so if my child's vaccinated, your child's vaccinated, the kid across the street is vaccinated, that disease probably isn't going to be in our community. But when you have a low vaccination rate, those diseases can come back in. And remember, we're an international country. People come from all over the world. They had an outbreak in Columbus because they had people who came to go to college and brought diseases from other parts of the world. So it is very important. You get down to a certain level, and then the disease is going to be reintroduced into the population. What we're concerned about now is we don't have enough people vaccinated, and so the herd immunity is not there. So I say to people, you can't go back to the way it was. You need to wear your mask, keep your distance. One of the things that people don't realize is when you aren't immunized or your children aren't immunized, you put all of the older people in your family at risk. And do you really want grandma to get something because she may be immunocompromised, she may have diabetes, she may be on some chemotherapy? And so I tell people, if you have a new baby and people want to come see them, you show the baby through the front door window or through the window. No, you can't come in, and especially if you're not vaccinated. But why would you risk it when you don't have to?
Coming up next, we'll talk about health disparities and the role health disparities has played in communities of color. It's all coming up right after this. But first, here's the premiere of our PSA featuring the Little Giants boxers from Euclid, Ohio.
COVID-19. We've been fighting an enemy we cannot see. But with every punch, a new variant would arise, and its blows would prove to be devastating. Step by step, with every motion and movement of the virus, the Urban League of Greater Cleveland has stayed off the ropes and in the ring fighting for you. Through the Vaxxed versus Variant campaign, we continue to share information to stay ahead of our next opponent. We've taken some hits as numbers increased, but our eyes remain focused on the prize. As we battle COVID-19, we remain strong, resilient, relentless, and tough like little giants. We will win.
Welcome back to Vaxxed versus Variants, an Urban League update. We wanted to really touch base on the importance of understanding the role that health disparities have played in this crisis, and it truly is a crisis. Joining us in this segment, Dr. Latasha Jarrett. She's from the centers and she's the Chief Medical Officer. Also joining us is Dr. Charles Motlin. He's a staff urologist at Metro Health Systems and the Medical Director of Equity, Inclusion, and Diversity. Thanks for joining us on this edition of Vaxxed versus Variants. Let's get into it. Dr. Motlin, what can you say about that connection? We talked about statistics, we talked about how it's affecting people of color, but when you put in that whole piece, health disparities, what are we looking at?
Well, I think the health disparities are the overarching reason as to why more people of color, African Americans, Hispanic, Latinos, have suffered disproportionately from this COVID-19 pandemic. You know, we've seen these statistics, and the statistics don't lie. I mean, African Americans develop or acquire the COVID virus about 3 to 5 times more likely than the majority population. We're hospitalized at twice the rate, and we actually have 2 to 3 times the incidence of death rates from the COVID-19 virus. And a lot of that is because of the existing chronic disease states that we most often see in minority populations. You know, some examples, higher rates of diabetes, hypertension, heart disease, kidney disease. All of these chronic diseases actually contribute to lowering our resting immune states and make us more susceptible to not only the COVID-19 virus, but the regular, yearly influenza. So we are more susceptible to infectious conditions such as the COVID-19, and then this is really underscores and it sheds light on the existence of health disparities that a lot of the population is not even aware of. We've spoken about it for a while, but we still need to spend more time educating the community about the existence of health disparities and the overall impact that it has on the shortened life expectancies in minority populations.
And you actually, Dr. Jarrett, was involved with a documentary sponsored by AARP. Talk to us a little bit about that, and we'll get back into the connection with COVID.
So I think that one of the things that minority communities face as it pertains to like medical care is trust. There is a lot of mistrust of systems, and so people may delay going in to get care because they don't trust the system. They don't trust that they're going to be taken care of, in a fair and equitable way. And so when they're faced with symptoms of COVID, their general fear, so they delay, where maybe before they got to the point where they had such low oxygenation or whatever, they just delayed. They tried to deal with it at home, or they're in situations where they're living in very close proximity to other individuals. So the difficulty with social distancing is great, or they don't have hospitals or medical facilities in their back door. So even just getting to them, even if it may be a couple of miles away, it may seem like they're traveling across country. So there's a lot of challenges. And as I said before, even when family members are thinking about, well, okay, if this person goes to the hospital, like, how are we gonna get back and forth to visit them? So all of these things really do, but I think at the crux of it is the fear and the lack of trust. So there's a lack of trust in systems. There's a lack of trust that people are actually being honest about what are the side effects of the vaccines? How is it tested? So there is just a lot of mistrust. And a lot of it is grounded in historical things that have proven to minority communities that they may not have always been treated as fair. And so it's real. And so there is going to be a lot of efforts that have to be made by the medical community to regain the trust.
And I think we've talked about that a little bit. Can you reiterate some of what she's saying about that and how Metro Health is tackling it?
No, I mean, it's a huge problem. And I think one thing for us as healthcare providers is that we need to project to the community that we understand their feelings, we understand the genesis for a lot of the distrust that is actually out there. We have to demonstrate that we understand this so that we can develop trusting relationships, with the community that are so desperately needed. Metro Health has a number of programs designed to address a lot of the social determinants of health, and we do know that racism and race itself are components of social determinants of health and contribute to a lot of the healthcare disparities. One program in particular that I'm proud to announce is our upcoming Minority Men's Health Fair, which is going to be held Thursday, April the 28th. Free health screenings for men of color. Actually, everybody is welcome, regardless of race or ethnicity, but we target men of color because we have seen that black men and black and brown men in particular oftentimes actually have higher levels of that distrust that we're speaking of. And again, it's due to a number of egregious actions that have occurred. The Tuskegee, the infamous Tuskegee syphilis experiment, where nearly 800 black men who the Public Health Service knew that they had syphilis, but they deliberately denied treating these individuals because they wanted to study the natural consequences of untreated syphilis, even though there was a treatment available. This study started back in the 1930s and went all the way up unbelievably until 1972. So, and again, these are the reasons for the distrust, but at Metro Health, again, we're doing a number of programs, but the Minority Men's Health Fair, I encourage all the men to come in to undergo free screenings. We are actually administering the COVID vaccinations during the health fair. We're going to be at 3 simultaneous separate locations, our main campus. We're going to be at our Cleveland Heights campus and our Broadway campus. Again, free health screenings. We have about 400 healthcare providers already signed up to help these men, when they come. We're providing health screenings from head to toe. So, we're all about promoting the health of the community, and we understand the plight of many people of color, and we look like, we are people of color ourselves, so we've had certain lived experiences also. It doesn't matter that we have MD degrees. We've experienced, racism, discrimination ourselves. So, we understand. So it's all about conveying to the community that we're here for them.
Let's all face it. All of us, some of us, or many of you that are watching have lost loved ones. This is serious. And many of those situations were due, as Dr. Motlin said, because of pre-existing conditions.
Yes.
But if we're not even going to the doctor, like Dr. Motlin mentioned, some of our men wait until the last minute, almost dying. When some of these patients were coming in, they were almost on their last leg. And as a medical professional, it must really concern you that we were either waiting till it was too late and the morgues were filling up with people of color. But where does that resonate in how you look at this whole thing?
So it makes me very sad, because our charge, especially in the community sector, is that we're supposed to be there for everyone. And so finding ways to connect with the people that we serve, or anyone in our community, for them to know this is a safe space to get help. So at the centers, we recently went through a strategic plan and put our stake in the ground that we're an organization that fights for equity and inclusivity. And so we want anyone who's in our communities, patients that we currently have, or anyone who's interested in being a patient, to know that this is a safe space. This is a safe space as it pertains to primary care services. This is a safe space as it pertains to behavioral health services. And this is a safe space as it pertains to psychiatric services. So in addition to our other service lines like our workforce and our early learning, but the most important thing is that we recognize that racism is real. We recognize that the trauma that's associated with years and years of discrimination and not being treated fairly, it impacts. And so, no one would argue that if you live under stress, it impacts you. And so when you see people who, for whatever reason, they don't come in, that's a failure on our part. We really need to figure out how to reach our community. So that's why it's very important in our organization that we have patients give us your feedback. Tell us what you need. We want to hear not what we think people need, but what do you really need? And then it's our charge to make sure we deliver that product. So it's always about a partnership, thinking about how can we be impactful. And then in light of what we see now, with all of the isolation, we're seeing so many more individuals, whether they're adolescents, whether they're adults, who are facing issues as it pertains to mental health. It has just exacerbated that. And so we have to take into account that even as we're treating diabetes or hypertension, we need to ask questions about mental health as well.
There are resources out there for our mental well-being or mental health, and a lot of times, physicians, we've ignored that aspect of the total health of the individual. But again, I think since the COVID pandemic has arisen, I think we're more in tune with the importance of addressing, mental health concerns. One thing, we were talking about it earlier, one thing that is really distressing is the stresses and the social isolation that we've experienced during the COVID pandemic has even affected our children. We're seeing escalating, an escalating incidence of even childhood suicide. Children as young as 5 years old, it's unbelievable. It's really alarming, and a lot of that is due to the social isolation that we're experiencing. So we have to address the mental health component. And it's not just about, manning up or being resilient. It's about addressing the total health of the individual.
We have been talking with Dr. Jarrett and Dr. Motlin about health disparities. More right after this. Coming up, how some school districts tackled COVID-19 while educating its students. But first...
Well, I think that everybody is kind of ready to move past COVID and start to get back towards regular life again, or what it will be after COVID, because it'll probably be a little bit different. And we can start to do that, but we also still have to understand that COVID isn't entirely gone yet. And so we still need to make sure that we're doing the things that will help protect us to stop us from either getting sick, getting other people sick,
and risking further complications. We still want to encourage people to get vaccinated if they have not gotten vaccinated yet. Vaccination is still the best protection that someone can have against severe disease from COVID. People may not be hearing about it as often because luckily our cases have dropped, but people are still getting sick, people are still dying from COVID. I have a high concern about pregnant women. Women should get vaccinated while they're pregnant. We've seen some pretty horrible outcomes, pregnancy-related outcomes for both mom and baby if mom gets COVID while she's pregnant. Getting vaccinated while pregnant also helps protect the baby. You can still take other precautions like masking, like distancing, like staying away from large groups and gatherings, but the thing that's going to protect people the most is vaccination. If you do have an existing medical condition, if you smoke, because we saw higher rates of COVID and more severe disease among smokers too, diabetes, hypertension, heart disease, anything like kidney disease, HIV/AIDS, then for certain to get vaccinated. Almost any medical condition, there's not a reason to not get vaccinated. There's very few reasons why a healthcare provider would not recommend that for someone. Almost universally, they're going to recommend a vaccination. The other thing is of course, to make sure that whatever your medical condition is, that you're getting the proper care for that too. Because if your blood pressure is under better control or you're in a better health status overall, then that can help if you do get sick to be able to get through it and bounce back, hopefully. While kids generally do okay if they get COVID, that we can see kids get very sick from COVID as well. And those cases are always tragic, and you don't know when or who it's going to happen to. So vaccination is still the best way to protect them. The biggest message is to stay vigilant. While we're in a great place right now, we've already seen, this is like our 5th wave of COVID surges, that it can change pretty quickly. And what people can really do is make sure that they stay up to date on their vaccinations. So, you may have had the first 2 shots, or you got 1 shot of Johnson & Johnson, and then you were eligible potentially for a booster dose. And now we got a second booster dose that just recently got approved for those who are 50 and over. So we have to stay up to date on vaccines. So even if you've gotten it before, your protection can decrease over time. So it's really important to make sure to keep your level of protection up, that you get those booster doses when you're eligible.
Hi everybody, I'm Jermaine Ratliff. I'm the first person in my family to get vaccinated. I got vaccinated because I wanted to show my family that it was safe. I also wanted to be proactive in a national pandemic. And that was me doing my part in contributing. If I couldn't do anything else, I got vaccinated to ensure my family's safety.
Welcome back to Vaxxed versus Variants, an Urban League update. Joining us are Dr. Lee Buddy Jr., the Chief Engagement Officer for Cleveland Metropolitan School District, and also one of they're now calling her one of the mothers of Cleveland, although she looks like she's a teenager today, Dr. Yvonne Pointer, who is not only a community activist, she is also the lovely host of Hope Haven. Thank you so much for joining us today.
Thank you. It's a pleasure to be here.
Well, Dr. Buddy, you also, for 6.5 years, you call them your babies, they're still going to be your babies, was the principal over at Wade Park Elementary.
Yes, ma'am.
So when all of this COVID hit, you were navigating as a principal. Now you're out in the community doing engagement work. Tell us like what that journey, being an educator, was like over those months.
So it was difficult, just trying to take care of our students, our families, our staff, not having a playbook to use to navigate, just a lot of different challenges in the community. Staff, kids not having technology, not having internet at their homes. The district did a really good job of getting PPE and was able to ramp up. So now every kid is one-to-one. They have their own laptop or iPad. Any family in the district is able to get free high-speed internet. The district has worked with the city to provide a variety of vaccination clinics. So we're at a much better part now, but really the journey, over the last 2 years, at times was really difficult, just making sure that, all of our stakeholders, but definitely our kids were okay.
And talk to us a little bit about some of the roles that you played. And when I say roles, I'm not talking about what we cook in the oven. I'm talking about you had many hats, including what you did with first responders. Talk a little bit about that.
Well, I love what you said about roles because I do cook those too. But it takes a village. We've heard that so many times. But this gave us an opportunity to implement that. We reached out one particular program. We realized that it was seniors that were isolated. So we reached out through Wade Park and we got some students. And we created a program where we had assigned a student to a senior. And their job was just to call them periodically. And then we even had cards made with the student's name on them. And so we had the students send the cards to the seniors. So now, even though they're isolated, they're connected. Well, another thing that we did was with the first responders, we worked with Chick-fil-A and B&M, and we got meals and we took them to all of the police districts, all of the hospitals, to the nurses. So what we found that even though we were isolated, there were still some things that could be done. All you need to do is just open up and be willing to do it. So working with the youth and the seniors, and somebody might say, well, where did you get all that money from? And I'm glad you asked that question, because we do the Hope Haven Monday through Friday, and we made appeals to the audience, and people gave. People are like, well, I can donate that, I can buy this. And so we're really grateful to have the opportunity to work in the community.
So Dr. Buddy, when we are looking at the whole idea behind vaccinations and the information about how now children as early as 5 can get vaccinated, was the school district responsible for just putting out the proper information?
So we've worked to just empower families to be able to make a choice for themselves. It's not mandated or required. I know at Wade Park last semester we did hold 2 vaccination clinics where, just to make it easier for our families that felt comfortable and just based on the information we had provided for them that they wanted to vaccinate their child. So we held 2 vaccination clinics, and then during the All-Star games that just took place in February, the district worked with the city and we passed out a variety of information for our families just to, once again, provide them the information on it, provide them locations where they could go get vaccinated. And the NBA also was a partner, and they provided some incentives with like tickets and different prizes like that. So we'll continue to push out information.
What kind of conversations did you have with your son and the grandchildren about at least being precautious and making a decision if they wanted to be vaccinated? What was the grandmother discussion?
Well, the grandmother discussion about that was as simple as this: let's pray about it. You know, we have to all be led by a spirit greater than ourselves, because no one really knows what's going on as far as that goes. So I would say to them, if you pray, even when I drop my granddaughter off every morning at school, I pray out loud with her so she can understand, and sometimes it works and sometimes it doesn't. But the thing is that we teach them to pray and seek wisdom as to what to do. and to still be careful and cautious and take your time about being in crowds and everything like that. Because you still have a lot of people that are just against the vaccination. And so we appreciate the correct information that's getting out.
I think in closing, I would like to ask, what does the summer months look like? Are things back in place, programs designed to help feed children? Are there going to be some changes because we're still somewhat in a pandemic? What can you tell us about that so far?
So we're really excited about the summer. Last year, we provided 8 weeks of summer learning for any student in CMSD pre-K through 12. This year, we're partnering with the city, so we'll offer, right when students get out of school, early June, we'll offer 3 weeks where they can sign up for camps and clubs offered through the library, the Metro Parks, the city recreational department. Then CMSD will offer 5 weeks for our K-8 schools, 4 weeks for high school, and then the following 2 or 3 weeks before kids go back to school, where once again, parents can sign up through the city or through the Metro Parks or library. So we're working to put out all that information shortly in the next couple of weeks so that they can make decisions. But we're really just excited to now have a coordinated partnership approach with the city. So the mayor has been behind it, he's asking for it, and we're just really appreciative to work with him and all of our other partners throughout the city to offer just a variety of experiences for students over the summer to keep them engaged so that there's not a huge summer drop or summer loss. So should be a fun summer for our kids in the city.
I want to basically say again, congratulations to you. Thank you, Dr. Buddy, for joining us, and it's always a pleasure to be with my sister, Dr. Yvonne Pointer. Thank God for you, and thank God for you. We'll have more right after this. Every school district faced challenges during the pandemic. Here's some lessons learned from the superintendent of the Warrensville Heights City School District.
All together as one team, our team did everything they could to ensure our students' basic needs were met, but also to ensure education continued. And also, as an organization, we wanted to ensure that we kept all our employees and that our employees who have helped us so much get to where we are remained with us throughout the pandemic. So we understood that coming out this pandemic, that we had to be back where we needed to be. And our success was based upon our schools, our teachers, our parents, all working together in person, not online. We saw that the online worked for a certain type of student, but it didn't work for all. So we were very determined to bring our students back. 2021 school year, we started to phase our students back in. January 25th parents had an option. Either they could bring their student back full-time every day, or they could remain online. At that point, about 50% of our parents elected to send their students back. Various things to ensure safety of our students. And throughout that process, we had minimal cases in the district. We did not have an outbreak in the district at all throughout that process, and we were able to continue school to the end of the school year without shutting down at all. So with that, we did an intensive plan to extend our school year. So we did 17 extra day school year for the end of the 21 school year. Again, it was voluntary, but we had over 500 kids participate in this school year. So the pandemic really taught us that the community and transparency and communication was essential, but it also showed how the community came together. So as we look forward, I think one of the key lessons from the pandemic is that we have to look at each child as an individual, and we have to be able to identify what they need and give them what they need. I think before the pandemic, it was just this mindset that everybody was the same. And with the pandemic, we found out that every child is not the same, every home situation is not the same, every kid's needs are different. And us as a school district, as an organization, have to adjust to what students need, because we pushing through this pandemic, but we've pushed through together. The students, the parents, the community, the administration, all, as our mantra here says, one team, one vision, one goal.
with Omicron and all these successive variants that could possibly be coming, they can get through, even when you're fully vaccinated and boosted. However, the good news is they're not landing you in the hospital. They're not landing you on a ventilator, and you're still here to tell the story. Make sure you're vaccinated. Make sure you get your booster, because now we're talking about it's going to protect you even if and or when you may get COVID. You want that extra protection.
Thanks for watching Vaxxed versus Variants, an Urban League update and discussion. We'd like to thank all of our guests who've participated today, and also reminding you to stay informed and educated about COVID-19 and the pandemic.